Thank you so much, Dr. Ngamijia. So we've got another question here from Ibrahim Yero. So I'd like to ask Dr. Michelle Yao to answer this question. And the question is about how the WHO predicted catastrophe in Africa, but obviously that's not happening, given that Dr. Moeti says so far we only account for 5% of the infections. But what explanation does the WHO give for the earlier prediction? And just talk a little bit more about the resurgence of the pandemic around the world, please. What do you foresee for Africa? This is a question. Dr. Michelle Yao?
Thank you very much. In fact, the predictions are based on different scenarios. So the scenario used is a wide community transmission with also the response capacity that we had at the beginning of this outbreak that was a bit worry for us that the system could be easily overwhelmed and the disease could spread faster. So this was element taken into account for this prediction. But of course, African countries took confinement measures earlier, closing school, as well as also limitation of movement. All this reduced the spread. So scenario did not happen, but is still not out of context in many countries. If measures have not taken, we can see when these confinement measures were eased, an increase that we observe in many countries. At least these measures helped to build some capacity. We had quite an increase in the treatment capacity as well as in the laboratory capacity. So our call was a kind of alert of something that could happen if countries are not mobilized and not taking the right action. So we are pleased to see that it did not happen, but it's not over yet. And it's why some of the measures, preventive measures, need to be reinforced. Is to what we notice in many countries that people are no more using masks or are not observing physical distancing. At the same time, countries should continue working. Decentralizing is critical. In fact, anticipating to avoid a worse scenario. Over to you.
Thank you, Dr. Yao. We do have Dr. Moeti back on the line with us. Dr. Moeti, there was a question for you earlier on from Suzanne Nijanji from AFP in South Africa. It's about healthcare workers, the number of infections in Africa, and that is Africa as in general, but also South Africa as the epicenter. And Susan also wants to know about the daily infections. Seeing that they're going down in South Africa, we've seen a decline in recent days, she says. Does that mean that this is likely to be mirrored in other countries as well? Dr. Moeti?
Okay, thank you. Sorry about that. We are having sometimes connection problems here in Brazzaville. So we've found a way of getting some information from countries about the number of healthcare workers that are infected. And we've had so far feedback from 41 out of our 47 countries in the region, and indicating that about 35,000 healthcare workers are infected. So South Africa clearly has the majority of healthcare workers who are infected at 24,000, a quite significant proportion of these healthcare workers who are infected. And indeed, we have started to see a decline in the daily number of cases in South Africa. I heard the Minister of Health, Minister Zweli Mkhize, saying a couple of days ago that, yes, this is something that's starting, but we need to observe it for a little bit longer before we say firmly that this is a trend. There are a number of other countries that are seeing similar decreases to a similar degree, about 20% fewer cases the last week than had been the week before. And these include countries like Nigeria, Cote d'Ivoire, Cameroon, the Republic of Congo, where we are, Mauritania, the Democratic Republic of Congo, Central African Republic, and then several Southern African countries, Botswana, and some West African countries like Liberia and Benin. So we do have countries where despite the fact that the governments did a relaxation of the measures, there was an initial increase in cases in several of these countries. Now we're starting to see a decline. I think what the take home is that we need to monitor this and just assure ourselves that this decline continues, that it's sustained. Thank you.
Thank you, Dr. Mwedi. This next question is for Dr. Ngamije. It's from, let me read it. It's from Ivan Mugisha from the East African newspaper. And basically, it's speaking about how Rwanda is seeing the number of cases decline to almost 10. And he wants to know, what are the prospects then of the reopening, not only of the economy, but also other aspects of social life, school, etc., etc. Dr. Ngamije?
Thank you. The cases are not decreasing so much as we wish. I think for the last 2 days, it's really good. But for the last week and before that, we had a certain number of cases, around 20, 30 cases per day. It's only the last 2 days where we have a few cases. We hope this trend, if this could continue, that would be okay. So, and it is in that perspective that different measures were taken to resume different activities, including churches reopening, and different business reopening as well, including the opening of air border, the airport of Kigali. So far, schools are not yet opened. We do still watching the situation at the end of this month to see what will happen. So decisions are taken depending the trend of the incidents. And for sure, if everything continues to go well like we wish, additional decision will be taken. But so far, we stick on those decisions that were taken. The last one was the opening of the airport of Kigali.
Thank you very much, Dr. Ngamije. We've got a question here saying that with countries like the US pumping millions of dollars towards manufacturing COVID-19 vaccines, it's clear that Africa not only needs to carry out its own efficacy and effectiveness study, but align itself with a country or companies that will see the continent also get the vaccine on time. So the WHO has spoken about this. If I could just also perhaps bring in Dr. Mainasara to talk about this, we'll come back to you, Dr. Mwedi. But just what are the challenges? I know testing challenges were mentioned earlier on. How are you overcoming this? How are you capitalizing, optimizing your resources, Dr. Mainasara?
Merci. Effectivement, nous avons des défis dont les principaux tournent autour du déni de la maladie, surtout des fausses informations qui ont circulé sur les différents réseaux sociaux par rapport à cette maladie. Il y a un autre grand défi, la réouverture des frontières. Nous venons le 1er août d'ouvrir nos différentes frontières, surtout aériennes, au niveau de la capitale à Niamey, à Agadez et à Zender. Il va falloir mobiliser beaucoup de moyens parce que il y a des conditions qui ont été fixées pour, par exemple, l'arrivée d'un passager au Niger. Il doit présenter un test valide d'au moins 72 heures. Et si il n'a pas de test, il doit payer pour pour que le test lui soit assuré. Mais si le test est valide, il continue vraiment son chemin et on donne des conseils d'autoconfinement. Si c'est quelqu'un qui doit quitter le Niger vers l'extérieur, là également, il doit présenter un test PCR valide d'au moins 72 heures pour éviter l'exportation de ce virus vers l'extérieur. Et il y a un autre défi, c'est par rapport à l'insuffisance des respects des mesures de barrière. Là, la sensibilisation continue. On est en train d'intensifier la sensibilisation à tous les niveaux parce que, comme je l'ai dit, il va falloir apprendre à vivre avec cette maladie. Donc, les mesures barrières s'imposent à tous aujourd'hui à partir du moment où les frontières aériennes sont en train d'être réouvertes dans tous les pays du monde. Donc, les mesures barrières s'imposent. Et il y a la difficulté de contrôle des points d'entrée, parce que quand vous prenez nos pays africains, on a ici en Afrique, je dis de façon particulière ici au Niger, nous avons au moins 15 points d'entrée terrestres, même si la voie terrestre n'est pas ouverte, mais quand même, il y a des gens qui cherchent tous les jours à faufiler. Il y a également, à l'occasion de la saison pluvieuse, les gens qui cherchent à regagner le pays par voie terrestre. Tous ces gens, il faut essayer de les confiner, il faut les tester avant de les laisser continuer, en tout cas au niveau des villages. Tout ça, c'est des défis aujourd'hui qui demandent beaucoup de moyens, et avec l'appui des partenaires, en particulier l'OIM, qui nous aide à reprendre, à prendre en charge certains migrants, certains retournés, et pour faire en sorte que ces gens soient testés, soient pris en charge, soient confinés, et qu'après le confinement, qu'on puisse les tester. S'ils sont négatifs, ils continuent leur chemin. En résumé, c'est les principaux défis auxquels aujourd'hui on est confronté. L'autre grand défi, c'est la vaccination. La vaccination, même hier, à l'occasion d'un échange par visioconférence qu'on a eu avec l'Alliance Gavi, cette question a été posée. On pense que d'ici 2021, si le COVAX serait disponible et que ce COVAX soit disponible à tous nos pays africains, là également, c'est un grand défi. Il va falloir une implication très forte des partenaires qui accompagnent nos États dans le cadre de la disponibilisation des vaccins dans nos différents espaces communautaires. Merci.
Thank you very much, Minister. And that question was, of course, from Elizabeth Merab of The Nation in Niger. So let's move on to this next question from Rhoda Adiambo from BBC Focus on Africa. So she's talking about malaria parasites in Rwanda becoming resistant to artemisinin. And if I could come to you, Dr. Gameje, to please answer this question. Are you experiencing this, and have you done any research on what is the cause of any such resistance?
Thank you. In 2018, 2019, we did a clinical trial, and we came to realize that in one clinical site, Masaka Health Center, we had some parasites, 19 patients with parasite presenting gene mutation against Artemisia. So it was 19 patients out of 257 total patients that were under that clinical trial. So, but in terms of efficacy of the drug through that clinical trial, we do still have 95% of efficacy in terms of treatment rate. So we believe that the mutation is probably due to natural selection or natural, let's say, selection of for the parasite to survive due to the huge pressure of different measures are in place to contain or to contain this malaria. Because we did even assessment with other parasite in South Asia, in Mekong. These two type of parasite are different. So it's not imported parasite. It's definitely endogen mechanism from the parasite to try to survive due to the pressure with different measures in place, including treatment, prevention for malaria that we have in the country. So we are still watching the situation. We increase the surveillance, and we hope that we should be sharing information with other countries and probably get possibility of other countries also to monitor the situation, because probably we discovered it, but other countries might have also those kind of situation, just because the system is not yet there to detect mutation of this gene against of parasite against Artemisia.
Thank you very much, Dr. Ngamije. Dr. Mweti, this next question is from Hudson Kutisa from the New Times in Rwanda, and it's basically talking about what he perceives as a lack of enthusiasm by Africans to be involved in vaccine trials. He asked whether if you foresee this as a problem and how else can you encourage them to buy into these vaccine trials. Is this what you're observing, Dr. Mweti?
Well, yes. What we observe so far is that we have only one African country, South Africa, which is already actively engaged in a vaccine trial. We knew that several other countries were in the pipeline. I know that Mali and a couple of others were considering this, and the work was being done to review how they could get involved in vaccine trials. As WHO, we strongly encourage the member states to be engaged in these trials so that we have the opportunity to see how these tools, the vaccines, work in African populations. We know, of course, in order to do that, you need volunteers. You need people to come forward and want to be subjects in the trial. And we are very concerned as well about the emerging, if you like, negative sentiments among African populations in some cases about participating in trials and vaccine trials in general, because in the early part of the pandemic, there were some discussions implying that African people were to be used as guinea pigs for the development of vaccines. And then most probably Africans, because of cost issues, would not even be able to benefit after the vaccines had been developed, would not be able to afford to have access to these vaccines. So this is part of a kind of infodemic, as we call it, false information that is around. And we want very much to dispel these negative rumors. There are very strict guidelines under which these trials get conducted, and populations and countries that have been involved in the trials have the right to have access to these tools. These are the principles that we're very much promoting as WHO and as well as some of our partners at the international level. So we can only continue to encourage countries and very much the population to be interested in being part of discovering these tools, because it will be to our benefit.
Thank you, Dr. Mweti. Let's just get some final words from our panelists now. Dr. Ngamije, let me come to you to talk about the possible challenges that Rwanda may face. You've done very well in obviously being proactive from the beginning, but does that mean that the low numbers that we're seeing will continue? Do you fear a surge, as the question was asked earlier on, and how would you manage that? Just your final words in about a minute, please.
Thank you. I think challenges we are facing today is that in the region, for us, it appears that there are still a lot to do to harmonize and synchronize intervention in the region. We are still facing cross-border transmission, high risk of cross-border transmission with truck drivers who are serving in the region. This is one. Number two, as we open Kigali Airport, we are already starting to receive passengers, some of them coming with rapid test results. And while clearly we said we are just accepting only PCR tests, so it gives us additional burden for keeping them, testing them until we have their result negative. But as they travel, they will be with crew who are Rwandese, especially those coming with Rwanda from different countries. So this is a challenge. It's a challenge for, resume economy, but also preventing a new cluster from people traveling with different aircraft. These are big challenges that we are facing today. The other one is availability of all kits, especially as we use different platforms for testing COVID. Sometimes you have some platform without available kits on the market. although we want to buy, but we might spend like a month, 2 months waiting the arrival of those kits. So basically, these are big challenges that we are facing for now.
Well, thank you very much, Dr. Ngamija. Dr. Mainasara, just to hear from Niger, you mentioned earlier on, I know you also have challenges of malaria, malnutrition, but there's the insecurity that you're seeing in the Southeast and Southwest. How do you think that will impact on your COVID-19 positive incidence rates, and how are you going to manage that?
L'impact de tous ces facteurs, l'insécurité, la malnutrition et autres facteurs qui ont un coût sur le budget de l'État, parce que la prise en charge de la COVID sous-tend avoir des moyens suffisants pour faire face à tout le mécanisme de la prise en charge, à la mise en œuvre du plan de riposte. Le gouvernement, en tout cas, est en train de prendre des dispositions d'ores et déjà à l'occasion de la table ronde de mobilisation de ressources. Et pratiquement tous les partenaires qui se sont annoncés aujourd'hui sont en train de concrétiser leur appui envers le Niger. Et également, les autres partenaires techniques, durant pratiquement tout le mois, nous avons eu à réceptionner et tout ce qui est intrant, qui va de médicaments, de consommables, des moyens de protection, des moyens de détection, les tests rapides, les tests PCR. En tout cas, nous sommes en train de les assembler pour faire face, en tout cas, à la réouverture de ces frontières aériennes. Mais également, l'autre défi, c'est le suivi électronique, le suivi électronique pour faciliter le suivi de contact, pour faciliter l'autoconfinement. Parce qu'à partir du moment où on a ouvert les frontières aériennes et on a pris la décision d'autoconfiner, il faut qu'on fasse un suivi rapproché de tous les gens qui reviennent pour qu'au moindre doute, au moindre symptôme, qu'on puisse tester la personne, qu'on puisse au besoin prendre en charge la personne. Et l'autre défi auquel on doit faire face, c'est la mutualisation des efforts de l'espace CEDEAO. Parce que, comme vous le savez, il y a beaucoup de nos pays de l'espace CEDEAO, au nombre de 15, qui ont été confrontés aux mêmes réalités de gestion par rapport à la mise en œuvre de ces mesures. Lors de la 21e Assemblée générale des ministres de la santé de la CEDEAO qu'on a tenue avant-hier par visioconférence, des résolutions très fortes ont été prises pour mutualiser les efforts, pour faire en sorte que les ouvertures de ces aéroports soient synchronisées pour que le test PCR soit identique au niveau de notre espace, pour éviter l'exportation ou l'importation de cette maladie dans notre espace. Merci, merci.
Thank you very much, Dr. Mainasara. Dr. Michelle Yao, let me ask you this question very briefly. The search teams Dr. Mwiti spoke about having arrived in South Africa. Is there a hope perhaps that they will help inform what else to do on the African continent? Will you learn more from the search team in South Africa on how to handle what's happening in other countries? You are welcome to answer this question in French.
Bon, le déploiement en Afrique du Sud, c'est un appui complémentaire par rapport à l'appui que l'OMS apporte depuis le début par la présence de son bureau. Et ces genres de missions, on apprend toujours. Cela nous permet d'identifier un peu qu'est-ce qu'on peut mieux faire pour accompagner les pays dans divers domaines. La directrice régionale a mentionné les aspects d'une analyse fine pour la décision de santé publique, mais aussi l'accompagnement dans la formation. Comment est-ce qu'on peut partir de là en ayant laissé sur place une capacité beaucoup mieux formée pour la suite de l'épidémie, mais aussi pour le futur. Donc, ce genre de déploiement nous permet de comprendre davantage la dynamique de l'épidémie, de partager les bonnes expériences, mais aussi de corriger notre approche et notre compréhension dans cette épidémie. Merci.
Thank you, Dr. Yao. Dr. Mweti, let's end with you. The question was raised earlier on about the battle for resources. You mentioned the issue of the shortage of testing kits, but I think a lot of developing countries' concerns is the fact that they don't have the financial muscles that the developed countries do, that when there eventually is a vaccine, that will lag far behind. And I think that also goes in tandem with a question about, you know, the projections. We are at the 1 million mark. Does that mean that because of this, perhaps we'll see an exponential rise in cases? Just your final words on that, Dr. Mweti.
Yes, I think first of all to the projections, you know, we had based our projections on a starting point of community spread, widespread community spread happening. So because of the early imposition of these very severe measures, that did not actually happen. So I think the course of the epidemic, of the pandemic in Africa has been quite different from what we had predicted, has been much less. It's difficult at the moment to say when it's going to peak. We think it's going to be here at a kind of slow burn, if you like, of the type that we are seeing in many countries. We're very encouraged to see the start of a reduction in some countries, even if there are some countries where, I think about 10 countries where there is an increase, but not exponential. So we think that the situation will continue to need a lot of effort, and we are very much then looking forward to the availability of a vaccine at some point, hopefully next year. And here, to answer that second question, we're of course working in WHO with other multilateral partners, with some bilateral member states, African and Western and other, and globally, in fact, member states, to put in place a mechanism, a platform coordinated by Gavi, where all countries will be able to equitably have access to vaccine supplies once some vaccines become confirmed as being efficacious and safe. We also observe, of course, that some countries, some upper income countries, are paying hundreds of millions of dollars to secure supplies of vaccine in advance. And we would like to hope that there will be a balanced approach to doing this with the same countries, because some of them have been involved in some of these multilateral mechanisms, really working with at the global level on a strong drive for equity in having access to these vaccines. The African Union, with the Africa CDC as the operational arm, has also mobilized African countries, mobilized financiers of access to vaccine to them. Then ourselves, as the African continent, do our part to make sure that we are engaging in these processes of putting money up front in order to make sure that Africa doesn't get left behind. This is an issue that I think merits close following up. It merits strong advocacy at the global level, at every level, for, if you like, global solidarity. I think it really does merit global solidarity for those who are able to pay in advance, to be aware as well that as long as we have countries whose populations are vulnerable, and as long as we continue to be such an interconnected world, then this will continue to be a problem for even those countries that manage to vaccinate many of their populations. And we've observed in some of those settings that there is a high degree of vaccine denial, and some surveys are showing that significant proportions of the people say they will not accept a vaccine even if it's not available. So it's a very much interconnected problem, and I hope that it can be addressed in that way among member states. Thank you.
Thank you, Dr. Mweti. And I certainly do agree that it's something that needs teasing out a bit more. There was a question earlier on about whether 15% of countries' budgets are enough to fight this pandemic. So we will, I'm sure, expand on that at another time. Thank you very much, Dr. Matshidiso Mweti, WHO Regional Director for Africa, who was joined by Dr. Michelle Yao, who's the Emergency Operations Manager in Niamey. Thank you very much to the Honorable Dr. Idi Ilyaso Mainasara, And in Rwanda, the Honorable Dr. Daniel Ngamejia, the Minister of Health. Colleagues, thank you so much for joining us. And I do encourage you to please make use of the Q&A function to send your questions in early. Unfortunately, we can't deal with them all, but we'll keep on persevering. Thank you very much to all of you.